Very good morning to all of you, respected Dr. Claire, Dr. Baldev, Dr. Noria, dignitaries in the audience, and of course, my dear friend Dr. Vitul. I congratulate you all for organizing such a wonderful conference here. As we were discussing earlier also, Dr. Sahab bol rahe sige, such, Dr. Claire was saying, that such conferences are very important for the updating of the knowledge, for our own benefit, for the patient benefit, for ethical practice, and as well as for our own safety as from the medical legal point of view also. So, Dr. Vitul has been doing a great job along with his team. Every year I am invited here. This time I am representing from Punjab Medical Council, and as already announced, declare 16 credit hours for this conference. Sir, Dr. Claire was saying that it's very important to be updating yourself, and in the earlier Dr. Jindal was quoting that cardiology is very difficult branch. So I will just take a few minutes. What we see in Punjab Medical Council day at every meeting, we have number of complaints, genuine ones, non-genuine ones. But why I'm trying to take a few minutes from you is because we should be very, very responsible in our, I will say, dialect or meeting with the patients or patient attendants when we are counseling them or seeing any reports. I'll just quote you the latest case which was there with me in the Ethical and Disciplinary Committee. I won't the name, but it was from this town only. Patient area ACS de which acute coronary syndrome. He's landing up in the emergency in the hospital. Pain chest hai, ECG kitty evolving STEMI hai. They do a angiography. 100% LAD blocked hai, 70% circ blocked hai. Severe LV systolic dysfunction है 25% EF है IABP लगाना पे उन्होंने उदी angioplasty किती है patient ultimately lands up in recovery stabilizes and then goes into VT. There is a cardiac arrest, revived. He had I think maybe cerebral anoxia, had some features and all. Ultimately patient was referred to a higher institution. Maybe he was saved or not, that was not there in the file. Now why I'm telling you the whole story is the certain doctor relation of that patient or attendant in a very irresponsible statement tells them ਤੁਹਾਡੇ patient ਦਾ ਕੁਝ ਨਹੀਂ ਸੀ ਤਾਂ ਉਹਨਾਂ ਨੇ ਪੈਸੇ ਬਣਾਉਣ ਵਾਸਤੇ ਐਂਜੀਓਗ੍ਰਾਫੀ ਐਂਜੀਓਪਲਾਸਟੀ ਕਰਤੀ. You see, just one irresponsible statement of a friendly so-called doctor spoiled the whole game, whole show. Patient the 100% LAD blocked hai, 70% circ blocked hai, severe LV systolic dysfunction hai, 25% EF hai, IAVP lana piya unna nu, and he is saying ki tode paise banana vaste unhone karta. I had to spend almost 1 hour because my seat over there is a sort of semi-judge with a quasi-judicially powers and all. Whatever verdict I will give, it will go to the High Court and ultimately Consumer Court also, and give the same decision which I give will be replicated in the court and as well as in the Consumer Court. I had to spend 1 hour with the patient and attendants, given so everything. I am not a doctor, the friend, or I don't know the name of the doctor against whom the complaint is. But ultimately, he had a lawyer with him, कि जी doctor the doctor the favor ही करूँगा. So what I mean to say is, please, while doing your day-to-day practice, wherever you are practicing, private practice, medical college, corporate hospital, be very, very affirmative and responsible in your statement dealing with the patients and patient attendants. So, because of such problems, I land up with so many complaints sitting with me, and which I have a very tough time in saving my doctors. On the other hand, certain doctors are there, I will not name again, a doctor doing a job, cut on the little finger, making it dangerous to life, or this thing on the letter pad also. Against whom he has made, they were government employees, they were jailed for 6 months, he lost the job, you see, and ultimately the case lands up with me in the Punjab Medical Council. You have to punish the culprit doctor just because he made us lose our job and made it suspended. So please, such conferences, again, I will say, are again, you will say, leading us to do our ethical practice in discipline and to be updated with the latest things, as Sir Dr. Clear was saying. Keep on going, Dr. Bitul, with such conferences and educating all the doctors in our fraternity and the, I will say, whole state. Not taking much of your time, once again, again congratulate and give you best wishes for the wonderful rest of the conference. Thank you.